There are 325.7 million people in the United States, and out of them, more than 500,000 children have had a tonsillectomy. But hold up, what does that big scary word even mean? Well, tonsil comes from the Latin word tonsilla, which refers to the anatomical structure in your mouth. Ectomy is a suffix meaning to remove, so put them together and bam! You get tonsillectomy, the surgical removal of the tonsils. This invasive surgery is actually very common, especially among young children, because their immune systems aren't quite developed yet. Now, what exactly are tonsils? Tonsils are a pair of lymphoid tissues covered by pink mucous membranes located at the back of the throat. On the surface of the membranes are little pits called crypts. There are 3 types of tonsils: adenoid tonsils, which are behind the nose above the throat, lingual tonsils, which are at the base of the tongue, and palatine tonsils, which we're going to be focusing on today, and they are located near the back roof of your mouth. Normally, tonsils are one of the first lines of defenses of your immune system. They pick up bacteria or virus particles that may be breathed in or swallowed. The crypts on the surface of the tonsils increase the surface area and allow more foreign agents to be relayed into the immune system. But sometimes they can become infected themselves because they're constantly trapping the foreign bacteria and food particles, which can clog the crypts up. The tonsils then become infected, swollen, or inflamed, otherwise known as tonsillitis. So, okay, whatever, you have little inflamed tissues at the back of your mouth. What's the big deal? Well, if your tonsils are infected and swollen up, they begin to narrow the opening that leads to your throat. This is kind of a huge deal because this opening is essential for food and air to get into you, which allows you to breathe and actually stay alive. And staying alive is fun! This swelling can also result in other discomforting side effects, such as a fever due to the infection, coughing, trouble swallowing, and bad breath. A sore throat is also common, and since the ear shares the same nerve, you may experience ear pain as well. If your doctor does a physical examination and notices your throat is red and your tonsils are covered in a whitish coating, they will collect culture by swabbing the back of your throat and send it to a lab to figure out what bacteria is causing the infection. Some cases are mild, and good rest, hydration, painkillers, or antibiotics can solve the problem. In the worst case scenario, a tonsillectomy may be required. A tonsillectomy can also be treatment for breathing problems, like heavy snoring and sleep apnea. And now, it's time to take a little field trip back in time to 1000 years BC. The first mention of tonsillectomy refers to Hindu medicine. According to West's review of the history of medicine, the operators explained, when the tonsils were troublesome, they were seized between the blades of forceps, drawn forward, and with a semicircular knife, a third of the swelled part was removed. Only a part was removed because they thought too much blood would be discharged. Then Aulus Cornelius Celsus came along and went against everyone's beliefs. He proposed a method of completely removing the tonsils. He did this by loosening the tonsils, then tearing them out with his finger. He used vinegar for the post-operative bleeding. After this, in the 1600s, doctors were exploring the idea of removing the whole tonsil in a less gruesome way. George Vaugh published his 900 cases of dissecting out tonsils using forceps and curved scissors. Previously, there were no anesthetics used, but by the middle of the 19th century, they were introduced for safety. The tools were also modified as the years went by, and this resulted in the traditional dissection and snare method. Okay, I've had enough of this history. Let's travel back to 2018. Luckily, technology has evolved, and there are several techniques the surgeon can use depending on the patient. The surgical team is usually composed of an otolaryngologist, who is a specialized physician that deals with the diseases and disorders of the ear, nose, and throat, an anesthesiologist, who is a specialized physician trained in anesthesia, so they make sure the patient is correctly administered the right dose of drugs and that they wake up with no complications. A surgical technician helps the surgeon prepare patients, the room, the equipment, everything for the procedure, and they also assist during the procedure as a part of the operating team. Other nurses may also be present for extra support, as well as resident students who may be observing the surgery to gain knowledge. So, how exactly does a tonsillectomy work? Well, prior to the procedure, you will be put under general anesthesia by the anesthesiologist. You will lie on their bed in the rose position to provide a good view for the operator. A breathing tube will be temporarily inserted through your mouth and into your throat to help you breathe when you're asleep. One of the tonsillectomy options includes the traditional dissection and snare method, where a scalpel and blunt scissors are used to cut into the mucous membrane, and a tonsil snare is used to cut out the tonsil. The electrocautery method removes tissue by burning it with a special tool, which can cause significant damage to the surrounding tissues like burning and charring. But the most common method is the coblation method, which is an advanced technology that combines low temperature radio frequency energy with natural saline to create a plasma field. The plasma field is located at the tip of the device and dissolves tissues molecule by molecule, resulting in a precise dissection of the tissue. The coblation process uses about 530 degrees less temperatures than electrocautery, so it doesn't damage the surrounding tissue and allows for a quick recovery. Firstly, a Boyle-Davis mouth gag is inserted into the mouth to ensure it stays open during the surgery. A tongue depressor is also used to keep a clear view of your tonsils. Tonsil forceps are used to hold your tonsils away from the healthy tissue, while the surgeon uses the coblation wand to slowly dissolve the tonsil tissue and remove it. There is usually no bleeding while performing a coblation tonsillectomy, but if there is, an instrument called the cautery is used to heat the small connecting vessels and seal the wound. And voila! Just like that, your tonsils are gone.
Wow!
This is an outpatient surgery, which means that you can go home on the day of if you're all cleared. After the surgery, it will take at least 2 weeks to feel somewhat normal again. It is also important to eat soft foods and stay hydrated to avoid further pain. Some side effects you may experience in these 2 weeks can include trouble swallowing, nausea and vomiting, pain in your throat, ears, jaw, or neck, which is why it's important to take the pain medication from your doctor, light bleeding, which can be managed by placing gauze in the area, or a bacterial infection, which will result in a fever, but this can be managed by taking some antibiotics from your doctor. You will have a follow-up appointment with your doctor after a week, but if any complications arise before that, it's important to see your doctor as soon as possible. Unfortunately, there are long-term effects of not having tonsils. A study led by the University of Melbourne found that tonsillectomy was associated with almost tripled relative risk for diseases of the upper respiratory tract, like asthma and pneumonia. This is because you are removing the tonsils that usually help combat foreign agents, so bacteria and viruses have a higher chance of infecting you. The absolute risk was also substantially increased by 18%. Dr. Byers stated, "Our results support delaying tonsil removal if possible, which could aid normal immune system development in childhood and reduce the possible later life disease risks." In some cases, after many years, these pesky little tonsils can begin regrowing. For example, our very own Miss Aviduto has had 2 tonsillectomies. Did you know that 30 years ago, approximately 90% of tonsillectomies in children were done for recurrent infection? Now it is about 20% for infection and 80% for obstructive sleep problems. At the end of the day, even though removing your tonsils has pros and cons, every surgery is unique to the person and the situation. Well, that's all for today, folks. Thanks for listening.